chairperson for next session. I would like to invite Dr. Archit Gupta as a speaker on topic challenges and opportunity of young surgeons.
Good afternoon, everyone. So, challenges and opportunities of a young surgeon. The next few minutes are going to be some harsh truths about a young surgeon's life. Any resemblance to real events or people is purely coincidental. Please do not take anything to heart unless it inspires you to change the system. I would like to start with what is the definition of young. I am not talking about people over 60 who feel they are young. I'm talking about people who are in their early phase of their surgical career, probably 30 to 40 years of age. So let's start with the story of Mr. Amit. He was a young, bright child who always wanted to become a doctor. Worked hard, gave NEET UG, became a doctor. During his internship, he always wanted to become a surgeon. Again, worked hard, cleared NEET PG, became a surgeon. Once he was a surgeon, he realized his love for abdomen, and he wanted to become a GI surgeon. Again, gave an exam, cleared NEET, became a GI surgeon. And that is exactly when he thought he has reached the summit. He realized it is just the base camp. He's all lost. He's a GI surgeon, and now what? As Dr. Adarsh told me when I passed my exam, the real exam starts after this. So what once you've passed out? The post-degree purgatory, ab kya? We talk about fellowships. Fellowships in India or abroad, corporate hospitals or academic institutions, go to a second-tier city and start a private practice, or maybe there's some job opening somewhere that doesn't require 10 years of experience for an entry-level post. There is no structured roadmap, no career counselor, and absolutely no guarantee that your next move is the right one. Just a vague feeling that time is ticking and you should be doing something spectacular. The fellowship options in India are few, far between, and mostly cosmetic. They are poorly structured, poorly paid, or poorly recognized. There are few that are available, that are highly competitive. They often add more to your age than your skill set and rarely open new doors. Many of us do fellowships not for learning, but to buy time, to figure things out, wait for jobs, or just delay decisions. You may call them fellowship trained or maybe still unemployed. Fellowship abroad, the mirage of the West. Over-glamorized and under-delivering. What is the reality? They are very expensive. Tuition, living, exams, visas, no stipend. There's no hands-on surgery. You're more of an observer than a surgeon. Loss of operative confidence. You don't operate for months, years altogether. There are long pathways involved if you want to settle in there. You go in as a trained surgeon and come out as an overqualified observer with a great photo album. The expectation is hands-on experience, global exposure, career boost, but it is all just for Instagram bios and nothing more. We come to corporate hospitals versus academic institutions, the great Indian dilemma. It's like choosing between the underused or the overused. Either way, you're bruised. The first option is corporate hospital. You are a glorified assistant. You satisfy the egos of people. There is minimal academic growth, limited autonomy, and unpredictable contracts. Oh, academic institutions, the dream, training, research, surgery, shaping young minds, and whatnot. Seats? What seats? Where seats? There are hardly any seats. Maybe when someone retires, you will have a seat. Promotions need more paperwork than surgical skill. Start your own practice yourself, the DIY, do-it-yourself surgical nightmare. Be your own boss, they say. But forget to mention, you will be your own clerk, manager, accountant, marketing head, and security guard. The idea of opening a own setup, it sounds glamorous. However, you need capital. And no, love and passion for surgery does not count as capital. You drown in paperwork. You spend more time giving discounts than explaining the disease. And the scariest part, one bad outcome, one angry relative, one viral video, and one broken jaw. All your dreams shatter in that one day. And then there will be a committee formed to investigate what was done, and there'll be no changes thereafter. Then do your own practice. My favorite, work-life balance. Ask a senior surgeon about balance. They'll either laugh or ask if you're planning to quit. And then the next sentence would be, in our time, we operated, went home at 3 a.m., and we were back in the ward at 6 o'clock in the morning. They often dismiss it as millennial luxury or residency weakness. The truth is that the surgery never ends. Patients, emergencies, complications, they don't wait for your kid's birthday. Even when you are home, your mind is still in the OT, still with the patients who's complicated. Family time becomes a slot you try to earn, but usually lose. Surgeons are expected to be machines with emotionless focus and 24/7 availability, and also magically raise children and avoid a divorce. The guilt is double-edged. Guilt if you don't give time to work, guilt if you don't give time to family. And yes, if you ever utter the word, I need a break, someone, somewhere will whisper, he's not dedicated enough. When we compare divorce rate among surgeons, there is no Indian data as usual on everything. However, US data says there is a 22% higher likelihood of divorce in surgeons as compared to their non-surgical colleagues. Money matters, the rich doctor illusion. Oh, you are a surgeon, you must be loaded. Every relative, every friend would say this. Let's break it down. The take home as an entry-level consultant in Delhi is 1.5 to 2 lakhs per month. Inflation, oh, what's that? It's something. The salaries have been same for over years. You want a house in Gurgaon? It's rupees 3 to 4 crores for a 2 to 3, 4 BHK. House rent, 50,000 for 2 BHK. You save 1 lakh per month, maybe in the next 50, 60 years, you might have some dream home if we do not count inflation. Or you can marry rich, or maybe sell kidneys. It is not recommended though. The only thing you can afford in Gurgaon right now is a parking, and even that's on EMI. Next, publishing papers. You should publish more, publish or perish, says every boss. The reality, you have got tons of data, carefully cleaned, carefully collected, painfully cleaned, converted into a good paper. It's like doing laparoscopic surgery with gardening gloves. The roadblocks, there is no mentorship. You are told, write something, but no one really tells you what to write. Publication charges. Journals charge 1 lakh rupee a month. Oh, your entire salary goes there, and endless rejections. Except, then they say, just publish in Indian journals. Let's see, the 2 best GI surgical journals in India, Indian Journal of Surgery and Tropical Gastroenterology, both are not PubMed indexed. Conferences and lectures. Why don't we see more young surgeons at conferences? Because we are not invited. Let's be clear. It's not that we don't want to attend. It's not that we don't want to present, engage, or learn. It's just that we are taken to be too junior to be a faculty and too senior to be a student, and apparently invisible to the organizing committee. The panels will always have same 5 faces for the last 30 years. Why can't we have some young surgeons there? Why can't we have some newly passed out people there? They have read much more than everyone else, but no, we will not have them. We are not lacking motivation. We are lacking microphones. We are told to show initiative, but we are never given the mic. You don't become a good speaker by listening to lectures forever. Someone, somewhere, has to let you speak. Enough of the negative part, I'll come to the positive ones. Let's talk about the opportunities. One of the biggest thing that a young surgeon can do is find a mentor, because mentors accelerate skin acquisition They help you with technical guidance in decision making. They give you real-time feedback about procedures. They promote clinical confidence. They offer perspective, encourage independent thinking. They protect you against burnout. They help you with professional navigation. A good mentor just doesn't teach you surgery. They'll teach you how to survive it. They are the ones who guide you when you are lost in decisions, believe in you when you don't believe in yourself, teach you not just how to cut, but when not to, and sometimes sneak a samosa in the canteen. Mentors can't change the system, but they can help you navigate it. Team-based practice. A good team just does not do more surgery, it builds better surgeons. It helps by skill amplification through exposure. Because they are high volume centers, they allow repeated exposures to rare and complex cases. It allows specialization. Someone is great with laparoscopy, someone is great with pancreatic surgery, someone is great with colorectal surgery. And you learn each one of it. There are daily informal debriefs, on-table checkings, cross-checking decisions. You can always meet each other and ask about your decisions. There's shared responsibility. Tough cases are tackled together. There's better work-life distribution. On-call rotations and patient loads are lesser. The best thing about a good surgical team is you'll never feel like you are holding the scalpel alone. Adaptation of new technologies. This is the time that the young surgeon should adapt new technologies, including minimally invasive and robotic surgeries, digital and simulation-based learning. The scalpel is evolving, and the surgeon who evolves with it will be the one who is still operating 10 years from now. The subspecialty carving in niche areas, for example, subspecialty in HPB or colorectal, you operate just on one organ and just that one thing that you're known for. If you can't write papers alone, there are always global collaborations and research networks. You can always enroll yourself in multi-center trials, you can write review articles, you can be a part of committees like IHPBA and APHPBA, participate in their trials. And if no one gives you a mic, you can take the mic yourself. You can create your own in the era of social media, you can create your own surgical explanation videos, run academic pages, advocate for patient safety, surgical awareness, or resident rights. You can always be the bridge between residents and the senior consultants. You don't have to wait for 20 years to teach. You can just make one good reel. You will gain visibility, credibility, and sometimes even an opportunity. We may not have it all figured out, but we have the skill, the purpose, and each other. And that's enough to build, to heal, and to rise. The journey of a young surgeon is not easy, but it is ours to shape. Thank you.
Absolutely phenomenal talk. I echo with most of your things, what you have said. But all the clinicians sitting here, the 60+ young surgeons that you're talking about, have gone through the same phase of what you're going through as in today. And I personally believe that the young surgeons, if you compare the 60+ young surgeons, are better placed in the society as far as their surgical work is concerned. If you compare to what the surgeons of yesteryears have gone through to do that one case maybe in a 1 month's time. The younger surgeons today are placed at a better pedestal than the young surgeons of yesterday. And it is how you take up that ladder to a next step is what determines the difference between the 20-25 young surgeons and the 1960s young surgeons. I don't think, all of us have the positives and negatives, but that's my personal opinion. And the younger surgeons are better placed both, as far as I'm concerned, actually, others will let me know, both financially, work-life balance. You understand, actually, they're asking for more and then they're getting more compared to what was done earlier.
So the issue is that at some point of time, we have to stop comparing. 1960 did not have AI, 2025 has AI. We need to stop comparing at some point of time.
No, not compare. I'm not giving a comparison. What I'm saying is if you give so much of negative, suppose if you're saying you're earning 2 lakhs per month, the same thing happened when these people started their practice. Actually, you understand, again, you cannot, so it is, you just have to wait for the right
flat in Gurgaon was 50,000 that time.
No, say the 10,000 dose times is 2 lakhs now. This is what the financial expert was talking about.
Haryana, a practicing surgeon. I finished my MS in 1991 and I was posted for the PPSC selection and the Chutani sir was there. When I asked him that you are posting me to a station where there is no anesthetist and I am a surgeon, he said, who fool have asked you to join Punjab Medical Services? Then I came to Bhiwani by luck and I went for an interview and Dr. Sir Mahajan sir was the who took my interview. When I told him that there is a difference between what I want and what I have, he said, what is your age? I told him I'm 29. He said, I am 59 and still that difference is there. Wherever you are, do good whatever you can do and the God will help you. And that's the result. And we have done
Thank you.
wonderfully well.
Thank you
No
so much,
problem.
actually.
Whatever the problems are there, go, head, struggle, find your place.
Thank you so much, but that was a very beautiful exposition of what you're going through, the thing actually, but I think the present day surgeons are also looking into all these things to make sure that you surgeons are more comfortable.
Thank you. Thank you, sir. Yeah. Sir, the second part of the lecture was what I'm going through. The opportunities part was what I'm going through.